Before Thomas Embling went smoke-free, probably around 80 to 90% of the patients did smoke, so it was a very high population.
It was also a focus for how people spent their finances and often organised their week around being able to obtain cigarettes.
In the 80s or 90s, we all went to nightclubs and come back smelling of smoke. It was kind of like that, coming from work and smelling of smoke at home.
The main aim of going smoke-free was to reduce the risks of smoke and second-hand smoke for consumers, staff, families and any visitors who come on site. We felt that the evidence for quitting smoking is compelling. There's so much damage to physical health for anybody, and for people with mental illness, there are even greater risks. Smoking can compromise their mental state, and for people who have a mental illness and smoke, they have a reduction in life expectancy of up to 10 to 20 years.
So the board and the CEO identified that if we are truly going to be a recovery-orientated service, we needed to give our patients the best chance to have a whole of health approach.
When we heard that the facility was going smoke-free, myself and my colleagues were all excited. We're all from a fitness background, so it was something we have always been passionate about.
The first day we had, quite oddly, one of the best days I've ever had on the unit. Everybody was extremely nervous and we had extra staff. We were daunted thinking that 1st of July, nobody's smoking, there's going to be incidences. So we made a bigger effort to make it a good day.
You're not relying on the cigarette to doing your work, you're having to engage the patient and understand what exactly has happened, or how best you can support them, or how they're feeling about things. And that in its own is probably more effective than offering someone 5 minutes and having a cigarette on their own in the courtyard.